Hi, everyone. We would like to welcome you to an awesome BHC first healthcare presentation. And we are so delighted that we have a guest speaker all the way from Ghana. We have our international award-winning dentist, Dr. Emma Olivria. We also have Dr. Abel Adegoke, who is a well-known primary care physician, but also a specialty in cardiovascular. And my name is Michaeline Holdemarch, also known as Dr. Michaeline Holdemarch, and I am the founder and the chair of BAME Health Collaborative. And we are so excited to do this because dental care is one of the key areas of health that is always forgotten. So we are going to tackle that issue today, and I welcome you to join us. So without further ado, I would like Dr. Olivria to introduce herself, please.
Thank you, Dr. Michaeline Holdemarch. I'm Dr. Emma Oliveira, a specialist dental surgeon, very passionate about preventive dental health and cosmetic dentistry with over a decade of experience, and happy to be here on this panel today. Thank you.
Thank you. And we'd like to introduce Dr. Abel.
Yeah, thank you very much, Michaeline. This is, my name is Abel Adegoke. I'm a primary care physician, a GP, we call them in the UK, and in other parts of the world, they are called family physician. But I'm also a specialist in primary care cardiovascular health. I do cardiology clinics. I am a teacher, a trainer, a mentor. I've been a GP for over 25, 30 years. And I'm still quite passionate about promoting health for everybody. That's one thing that ticks me, that makes me happy.
Thank you so much for that introduction. And without further ado, because what we do with BHC is that we actually record this session, we share it with our panelists to make sure that they are happy with it before it goes out live. So just for your knowledge, this is also going to be going to the Sierra Leone Dental School. It will be going to Texas. It will be going to a Texas Dental School. It will be going to Trinidad Dental School. It will be shared with dental schools. So as you know, BHC do a lot of healthcare promotions, and we are really pleased that one of our new members, Mr. Rudy Page, and I'm saying it so that he can hear his name, he has been promoting this to the wider community as well. And then we will share it and share it and share the live video. But we do believe that the panelists should have an opportunity to see it. And then if they're happy with it, then we go out live. It's just some of the ethical aspect of BHC. And before we move, I'd like to let you know, I think Dr. Adeoke, you need to tell them, Dr. Abel, that you are part of BHC. So
I'm part of BHC. I'm one of the ambassadors for BHC. I've been involved now for almost a year plus. I particularly love the work of BHC because that's an opportunity for us as ethnic minority people, especially in Great Britain, to have the opportunity of influencing healthcare delivery, but also encouraging our own community who have been negatively impacted by many healthcare problems, just to encourage them to embrace the available healthcare needs, resources that are available to them.
Thank you so much for that. At this point in time, we would like to ask, people talk about dentists and they say, oh God, and most people like to go to the dentist when they actually have a problem. They got a toothache, a tooth is broken, some major issue why it is, they need to access the dentist. And I want us to change that, because dentistry on its own has a lot of other ill health issues if it's not managed properly, from your gums to your tongue to your teeth. It's a whole lot. And that's why we are doing this. So without any further ado, if you don't mind me if I say Emma,
That's fine.
kindly tell us what are the obstacles in accessing dental health? What are the obstacles for us? What are they?
So the main issue is that the ideology that oral health is independent of general health is there. We need to wipe out that mentality first of all, and see general health and oral health as together, as a pair. They work hand in hand. So for me personally, I look at it from a very wide perspective, okay? When you talk about dental health, it's in direct correlation to your general well-being. So when you have issues in the mouth, that can lead to issues in other parts of the body, and issues in other parts of the body can also end up giving you problems in the mouth. So for me, that is how I look at dental health. I look at it from a very broad, holistic perspective.
Thank you.
And you're welcome.
Dr. Abel, do you mind if I call you? What is on the side of the primary care? What do you think is the matter?
Yeah, thank you. The main problem, especially as it operates in the United Kingdom, is the segregation of dentistry from general medicine. You see, you have, and when contracts, when this healthcare is commissioned, there's a remarkable differences in the way dentistry is commissioned compared to the way general medicine or general practice is commissioned. And so the fact that a good proportion of dental activity is private is a big issue.
Yes, and no doubt about it, because a lot of people have to find the money to pay for their for dental health.
Yeah.
And so economics is a problem, but there's another problem, is that we don't really go for many other reasons.
Yeah.
And it starts from childhood. And I know, Emma, you do a lot in childhood, in children's dental health, and we'll come to that in a moment. But I mean, both of you are real experienced folks. What can we do so that people start accessing and making sure, even if you have to pay for it, that it becomes part of your health plan?
Okay, I think I'll take it first. Oral health has to be a habit, and brushing of teeth day and night, taking care of your oral health has to be a habit. Once it becomes a habit, it becomes easier for you to do it. So another thing is education. Education regarding oral health is very, very low. Even some of our GPs, as well as our health workers, don't know much about what we do as dentists. So for me, education is of paramount importance. It's crucial for us to educate our health workers, because we need to work hand in hand to address some of these issues.
Yes. What do you say, Abel? Do you agree with that?
Yeah, completely, 100%. And in addition to that, I think the curriculum of general practice training should have an opportunity of having a peep or an insight into dentistry. I had that privilege because I did my primary medical education in Nigeria and did general practice training in Nigeria. And part of that training involved me doing about 8-week rotation in dental clinic. And that opened my eyes. And so we need that, but also for the education, I think it's important to catch them young. I think it's important to bring the education about dental health in the very early stage of life. Just like you teach children about don't go with stranger, don't how to cross the road, I think it's important that we emphasize the significant aspect of dental health. Currently, emphasis are on lifestyle changes, which is exercise, what you eat, but I think we should put dental health care and prevention of dental problem as part of the current lifestyle changes that we're talking about.
Thank you. Now, I just want to say something. The reason why we didn't leave this as a complete webinar on the Zoom is because we really want the interaction of others to be really participatory so that we can strengthen the health promotion aspect of it. And you tapped on something that's really important, and that is food. Because what we put in our mouth, including me, does affect our glossy whites. So Emma, should I go to you first to just tap on that? Because that is really key. I mean, a classic is, I've been working away from home and I was so exhausted. I had a lovely glass of wine, but I fell asleep. The glass is filled. I haven't even drank most of it. But then I thought, oh God, I get into an age now where I really need to protect, you know. So could you tell us about nutrition, about alcohol, smoking, you know, all that sort of stuff, the effect it has on your oral care and your teeth. More importantly.
Okay, so a balanced diet is crucial not only for your general well-being, but for the oral cavity as well. We all know that the development of dental caries starts as a result of the sugar intake. So when you take sugar excessively and then it gets stuck on the teeth surface for a prolonged period of time, that is where you have microorganisms, predominantly bacteria, dissolving the acids on the teeth surface and then forming decay. Okay, so it's very important for you to have a well-nutritious, balanced diet. Another thing is that smoking also causes all sorts of issues, including periodontitis. That is where you have infections of the gum. So you have infections of the gum, gingivitis, and an advanced form leads to periodontitis. So you have the teeth becomes very sensitive, and then it can even become mobile. So you can end up losing your teeth as a result of that. Another thing that it can cause is oral cancer. Most of the oral cancers, especially squamous cell carcinoma, start from the mouth. And so the mouth tells us a story. It's like the window, you know, to the body. So you look in the mouth and you can see the issues or health problems that people can have as a result of that. So taking care of the oral cavity is very important. You need to ensure that you brush effectively twice a day. I always tell my patient that you need to use a soft or medium bristled nylon toothbrush to brush. And it's not about the number of minutes used in brushing, it's about the quality of brushing. So when you brush your teeth, for example, you need to ensure that you use a pea-sized paste. So when it comes to paste also, it's not about the quantity, it's the quality and the technique that is used in brushing. Okay, so you brush and you floss efficiently twice a day. And you need to visit the dentist also at least twice a year, so that problems can be picked up, solved before they become worse. Like I said before, I believe in preventive dentistry. Let's solve the problem now for the future. And it's even less costly when we solve issues. I mean, for example, in Ghana, access to oral health, when patients come in and you give them the treatment plan, the cost is always a problem for us. Now, if they had come in earlier, we would have used minimally invasive techniques to solve their issues as compared to something more, drilling or filling and so on and so forth. So the cost is also a big issue when it comes to oral health care. That is why it's important to prevent issues from happening before they become worse.
Thank you. As a primary care general practitioner, and you know your specialty is cardiovascular. I mean, what can GPs who are going to be listening to this and and dental students, and what can they do? Because you see more of the population. What can general practice do? Doctors all over the world, i.e. Ghana, across Africa, the Caribbean, what can they do to actually start linking that this is really an important part of healthcare provisions?
Thank you. First, we all need to be aware that dental health, it's not just taking care of your mouth. Dental health will help you take care of your whole body. So if we get that understanding and have understanding that there are some diseases that dental problem can either aggravate or even cause. And also some diseases we present as dental problem. So if we all understand that and we put that constantly at the fore of our mind, then we make every contact with our patient count with regards to dental health. You see, we talk about food before. Hippocrates, the father of medicine, says, make food your medicine. So as we encourage our population to be better with their food and their lifestyle, we should also constantly let them know that if they neglect their mouth, the mouth is not just your teeth. There are other aspects of it that you need to take care of. And if you neglect it, it's not just the pain that you will have. It's not just the caries that you will have. You can actually jeopardize your entire health. And so if we realize that each time we come across patients, and part of our job as primary care doctors, as GPs, family physicians, is education, is to use every opportunity to educate people. And if we can inculcate that with an understanding, I think people need to understand it very well and then bring that understanding into their education of the patients. That will make a lot of change to how people perceive their dental health care and how and what they need to improve it.
Definitely. Emma, Dr. Oliveira, can you tell us like 5, you talk about sugars. Yeah, you talk about sugars. Are there anything else that we should really be mindful of that, once we've had it, that we should what should we do? So, I have to be honest with you, I have a nasty sweet tooth. If I pass somewhere and there's a cake and there is a savory, salty something, although I'm nicely, I'm curvy, I'm on the right side of the curve, I will be drawn towards the sweet. I can't help myself, it calls me, it really calls my name in the softest of tones. And I will go across there and I guarantee you, I would have a little piece. What can I do? Knowing I've consumed so much sugars, or for those who know they are smokers and they're trying desperately to give up, I don't want to give up at all. Or those who drink, what can they do after that to ensure that, I don't look like I'm having decay because I just had so much carrot cake. You know what I mean? What can I do?
Okay. So what you should do is that after consumption, if possible, brush your teeth, okay? If you can, it's always advisable to brush it. If you can't, you can use water to rinse your mouth. The idea is that you shouldn't let the food that you've eaten stay on the teeth surface for a longer duration of time. So once you are able to clean it off the teeth surface, it helps reduce the cavity formation. So rinsing your mouth after eating helps, brushing if possible helps. And more importantly, visit us at least twice a year or as frequently as possible, so that, like I said before, problems can be picked up, solved before they become worse. Another thing that I just wanted to emphasize was that oral diseases can lead to other diseases in other parts of the body.
And we are going to come to that. That's one of our questions. We got to come to that. But before we come to that, you know, the health education aspect that we were talking about with primary care, it doesn't stay with the GPs. We're talking about nurses, we're talking about midwives. And I think healthcare professionals and allied professionals should really start pushing the agenda about oral care, dental health across the board. And also teachers and educators as well should also push that. But one of the things we want to talk about is like pain threshold. Some people, you know, very much, oh my God, I have to go to the dentist, it's going to be pain. And they start self-medicating. And with the great gurus of online medication, now I'm not going to call companies that you can buy it from. It is so easy to buy something, tooth remedy, this. You can, I will go to Abel and then come to you, Emma, because this is your whole area, but I'm going to go to him. We have a problem within our Black and ethnic community about self-medication. We have the best self-medication. Take a clove, put a piece of clove, put a garlic. You know, you just put 2 cloves, it will fine. You want it white? Get some baking soda and some bleach. That will whiten it up for you. I mean, we have all the remedies in the book. And I just want you right now, to tell me and tell us all about this self-medication that we do. And I saw Professor Rotimi laughing. I'm going to definitely ask him. We're going to ask Yinka. Brenda is there. These are the gurus. So go first and we will come to Everlast.
Yeah, I think it, like you have rightly put it, it's a menace in our community. And I don't know the origin of it, but the old wife tale is very rife. Yeah, there's a place for self-management and self-care. There's a place for it. But I think anything more than paracetamol over the counter, you're not doing the right thing. By the time you take 2 paracetamol and it hasn't helped you, or ibuprofen and it hasn't helped you, I will actually not encourage people to just take ibuprofen anyhow, because there are more danger with them than we know or people know. And therefore, it's not advisable at all to be self-medicating. Yeah, there are good reasons for self-care, but especially for those of us who live in the UK, there's no reason to self-medicate. There are so many avenues you can go to that will help you, give you the right kind of advice, and point you to the right place to get the right treatment. So all those things about using caustic soda and whatever to treat things, they're dangerous and bad. And my strong advice is please don't do them.
Okay, Emma, there are some people having some wonderful alternative therapies in the chat. I'll come back to that. That's for you to answer. So let's go across to Professor Rotimi. Self-medication for all your tooth and ailments, and even if you know everything at all, you know, Michaeline is making a potion here for that. So what do you think?
Good evening. You've drawn me into this. I wasn't expecting it. Self-medication really is not advisable for a number of reasons. First of all, the products have not been tested. They contain impurities. Yes, they might contain what is good. What we haven't done is to quantify or extract what is good from the impurities. And that's where we have to be very careful. You mentioned caustic soda. Yes, you'll find caustic soda in some toothpaste, but they've undergone trials and the concentration in them is what it should be. But when you go into just the herbal medication, then you don't know what the quantity is, you don't know what the impurities are, and you've got to be very, very careful about that. Lest we forget, most of the orthodox medicine come from plants, but the difference is that they undergo trials, they are verified, whereas we is just get the leaves, put it in a pot, and drink maybe a gallon or a cup. And that's where the difference is. And I think traditional medicine has to be incorporated or liaise with conventional medicine so that we get the best of both worlds. So that would be my take on it. Thank you.
Thank you. Yinka, I see you were putting up your hands. What do you have to say before we get back to Dr. Adeoke and Dr. Olivia? What do you have to say?
Oh, sorry, I didn't mean to put my hand, but I was swearing by clove oil. Clove oil is brilliant. When Dr. Abel said about paracetamol, true paracetamol, I'm thinking paracetamol. When toothache sets in, you don't even look at paracetamol, you go for codidromol. And while you're pouring the clove at the same time, if the codidromol doesn't work, then you're gingerly phoning the dentist.
Oh, definitely, definitely. I seen there Michaela Clark talk about rum. She also mentioned Wonder Leaf. I saw in here that Sandra talked about calcium. Oh, well, Brenda said coconut oil, brandy. Oh, it has a whole lot because listen, come on, Emma. Hey, toothache is no joke. Toothache is no joke. What do you say about all this wonderful stuff? Because to me, that's great, but you got to find the root of the problem, isn't it?
Exactly, precisely. So it's interesting because here in Ghana, people sell all sorts of things on the bus. So you sit on the bus and then you hear them saying, oh, for toothache, put something like this there. And then you see about 10 people trying to purchase, and then I just sit on the bus and I shake my head this way because it's totally wrong. Okay, so I don't advise using any of those things. When it comes to clove oil and then the other things that you've mentioned, as Professor Rotimi has rightly said, a lot of research hasn't gone into some of these herbal medications. So it's really not advisable to use them. It's imperative to seek professional help. So like I always say, come to us because sometimes the cause of the teeth, normally what we have to do is perhaps maybe take an x-ray, and for all you know, the medication that you're taking might not even help to solve the issue in the first place. It might be something as simple as changing your toothpaste or toothbrush, for instance. So it's always advisable to seek professional help and not self-medicate, because it's not only bad for the oral cavity, but also for your general well-being.
Thank you.
Yeah.
Well, someone phone is off. I think I'm gonna just mute it. But one of the things is that we started off with the cart without the horse, but we're gonna go back, and I deliberately did that. Dr. Emma, what is dental health really? What dental health? When I finish with this webinar and I really wanted to tell someone what dental health is, what is it?
Okay, so for me, dental health is, I look at it holistically, okay? So dental health is having a good general health also. So it's not only about the mouth, but it's about your general well-being. It goes hand in hand. So dental health is ensuring that your teeth, your gums, the structures in your mouth, as well as your entire mouth, it's in optimum standards, okay? And it helps your general well-being as well. Because when you have problems in the mouth and they are not treated, they can lead to other issues in your body. So for me, I look at it holistically, very broad. Dental health is having optimum general health also.
Thank you. Dr. Abel, when any of the population present to you as a patient and they have bleeding gums and bleeding and tongues that their tongue is all white and all the different aspect of it, and you could see that there's a lot of buildup of plaque. What comes to mind in regards to that health education there?
Thank you. The first thing you need to do, like I have said earlier on, is to know that whatever you're seeing in the mouth could just be a reflection of many other things that are going on. And therefore, it's not uncommon that the same patient with dental health problem has been carrying some major other physical health issues. And so for me, I want to take a proper look, a good examination, not only of the mouth, but every other part of the body. And then it's important to be able to signpost them. If I conclude that, yes, in addition to this mouth issue, there are other issues, take care of that, but signpost them to see a dentist who can actually do a better job of that.
Thank you. Go ahead, what you were going to say.
No, I was just going to say, as I said earlier on, it's important for us to make every opportunity count. So when you see somebody, educate them about their health, especially related to their dental health.
Thank you. Emma, before we go into bleeding gums and all of that, I just want to say thank you for that demonstration on brushing your teeth, because many of us learn to brush our teeth from our parents, isn't it? Doop, 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 doop. And when you explain how to brush your teeth, I was like, I can't believe I'm this age. Have I slipped up here a little bit? I'm not ashamed to say it was good learning. I passed it to my mom. I passed it to my husband. I passed it to other friends. And you know what? It felt orally clean. And so before we go into that, tell us about when you see someone with bleeding gums, because a lot of people have bleeding gums. They brush their teeth, and when they do, and they see blood in it, just continue.
True.
Tell us about bleeding gums.
Okay. So for bleeding gums, right, it could be due to systemic conditions, but I'm not going to delve into it now. I'll just look at the localized condition. So for bleeding gums, it's just you could have gingivitis. Gingivitis is an infection of the gum, and that can start with the bleeding gums. If it's not controlled, then it leads to periodontitis, okay, which is an advanced form of the gingivitis. Now, bleeding gums is also as a result of huge accumulation of calculus. Now, calculus is made up of bacteria. Now, it starts as plaque, and if it's not removed professionally, it piles up, compounds up, and it becomes what we call dental calculus, which is a hardened form of the plaque. Now, once again, when it's not removed, then it starts causing destruction. So it gives you bad breath, bleeding gums, sensitive teeth, and it even causes mobility. So you can end up losing your teeth as a result of that. And most of the times when people brush their teeth and they see the blood, they feel they are doing the right thing. No. Once you see blood in your mouth or when you are brushing, then it's obviously there's an issue. It's an indicator that problems are happening in the mouth and they have to be solved. Another thing that can aggravate the issue further is by using a hard brush. So most people use a very hard brush with very hard bristles. It's not advisable. You need to ensure you use a soft or medium bristled toothbrush at all times, okay? And also the technique involved in brushing is something that has to be part of you. Now, brushing alone wouldn't ensure your bleeding gums is controlled. You need to brush and floss, taking good care of the oral cavity, eating well-balanced meals, and visiting the dentist for regular checkups. And then also, like I said, it could also be as a result of systemic illnesses. So certain systemic diseases that you have can also lead to bleeding gums. A typical example is leukemia. So leukemia, for example, which is a cancer of the disease of the blood, cancer of the blood, can cause bleeding gums. So it's very important for us to look at some of these things from a very in a broad way.
Okay, but what about the tongue?
Yes. So for the tongue is a muscle. It harbors a lot of microorganisms. So after brushing your teeth, you have to ensure that you scrape the tongue. Most people go like that. I don't advise you do that. I advise you brush it or scrape it in one direction only. So it's like sweeping. When you sweep it, you don't sweep like that. You go in one direction. So it's the same way you need to brush the tongue. When you're brushing it, ensure you use gentle motions, but it should be a little bit of, it has to be firm. So even though it's gentle, it needs to be firm, and then you brush or scrape it off in one angle. So you just go like that, not forward and backwards.
Okay, that is very interesting. You all will have a few questions, but Dr. Abel, let's go to children's health. Brenda raised a good point about bleeding gums and diabetes. And I think we ought to take that before we go to children's health, because diabetes, most people of ethnic backgrounds, their family will have diabetes. And I see Professor Rotimi has something in there as well. But let's talk about diabetes, because diabetes is rife. It is rife across Africa, the Caribbean, India, Pakistan, the UK, America. It is everywhere. Are there any scientific link between diabetes and dental health?
Yeah.
Yes. Oh, sorry.
So, Dr. Abel?
Yes, definitely. Several researches have confirmed that either they coexist or one causes the other. They coexist because, like we have heard from Emma, major problem with dental health is dental infection. And diabetes is a condition where you have excess sugar going around in your body. And where sugar is, microorganism tends to be there. So a diabetic has a medium, a very good culture medium for microorganism to grow, and there is no paucity of them in the mouth. And if your dental hygiene is poor, you can really be certain that you will have a problem of dental infection, which can also lead to systemic infection. The other thing we found out is that there is a strong correlation in the way inflammatory process, which is what infection tend to bring, how the body react and respond to inflammation can actually cause breakdown of the entire system of the body, leading to diabetes, leading to atherosclerosis, leading to heart disease. So that has been shown in different studies that confirm it. So that's why it's extremely important for all of us to not just look at our dental health as a fashion, because I know some people brush their teeth because they want to make it look white. It's more than that. If you look after your mouth, you are probably doing a great job in looking after your entire health.
Thank you. So Emma, we might as well move on to what you were trying to link in, all the illnesses, the physical ill health that's linked to dental care. So we might as well go to that, and then we'll come back to Dr. Abel in regards to cardiovascular.
Okay, so we have viral infections that manifest in the oral cavity. So you could have herpes simplex virus, for example. You could also have shingles. Shingles is an advanced form of chickenpox, and it's caused by the varicella zoster virus. It also gives you manifestations in the oral cavity. You could also have hepangiana. It's caused by the Coxsackie virus. Once again, you have oral manifestations in the mouth, and bacterial infections also. So tuberculosis, you could also, it gives you several manifestations in the oral cavity. And then even fungal infections like candidosis or candida infections can also manifest in the oral cavity. So the oral cavity tells us a lot of stories. We look in the mouth and we know the issues or the kind of diseases that the patient might have. And it's also linked to some of these systemic autoimmune diseases. So you have systemic lupus erythematosus, lichen planus, all of them also have manifestations in the oral cavity. And even some endocrinal issues. I mean, some of these diseases, they all manifest in the mouth. So it's very important for us to have a clearer picture when it comes to dental health. We shouldn't just isolate it and think that the mouth is not part of the body. We should incorporate it into our general medicine. It should be an integral part of general medicine.
Thank you so much. What about cardiovascular? We hear about this, but I just think that you're not brushing your teeth properly, and it could end up with endocarditis. As Professor Rotimi, I'll come to you. What can you tell us about that? Because that's a bit worrying, that if I don't brush my teeth properly, that I could end up with a cardiac ailment.
Yeah, there are about three ways that problem in your mouth can either trigger or exacerbate an already existing cardiovascular problem. And as we know, cardiovascular diseases are the highest or the greatest killer in the world, all over. And I want to emphasize that, you see, we have many people dying from road traffic accidents. We hear lots of disasters, natural or man-made, that kill people. But still, as of today, in the entire world, cardiovascular diseases are the major #1 cause of death. So it's important that we take care of our cardiovascular health, and the mouth can contribute significantly. There's something we call bacteria infective endocarditis. This is when the valves of the heart is infected by bacteria, and it leads to formation of what we call vegetations, which are clumps of microorganisms together with blood clots, and it destroys the normal function of the valve. So the valve is supposed to close like this and open and close, but if there are vegetations on them, they don't work properly. Plus, they release toxins right into the heart. And those toxins are easily transmitted because heart is the storage and the pump that get blood to every part of the body. So once you have toxins and infection in your pump, it's a matter of just one pump action, and that infection spreads to everywhere. If it's not recognized quickly, it's a killer. A lot of people will die from infective bacteria endocarditis. So that's why it's important to keep a good tap on your oral hygiene. And especially if you are going to have certain procedures, the dentist, we deliberately give you prophylactic antibiotic to protect you from having these. But you can shed bacteria into your bloodstream even without having any procedure. So that's why it's important that we take care of our health, of our mouth health.
Yeah, and as we on that, I just want to say, for people who are going to have surgery, if you don't have good teeth in your mouth, please do not come, especially those who write to Michaeline about complaint that the anesthetist broke your teeth, yeah? Because if you don't have, not taking care of it, the poor anesthetist who tried his best to keep you alive, and you come out and you don't have good teeth in your mouth, please don't write to Michaeline. Yeah. I just want to say that because I get a lot of people writing me and go, Michaeline, you know, I had surgery and next thing I come out, my tooth was shaking and I want to sue. What do you think? You need to ensure it's strong enough and tell I think actually, I'm saying that, but I think we have an anesthetist on here. I want to be at sea. Uganda, Dr. Uganda, you are here. Right.
Hello, good evening.
Am I right?
Yes, you are right. So we do always ask patients about the condition of their teeth. And we also warn them that one of the risks of general anesthetics may be dental damage. So if they have any wobbly tooth or if they have loose dentures, we advise them to take it out before general anesthetics.
You see, I'm telling you people, if you want to be a fashion icon and you know that your teeth not good, go see the dentist and then get your surgery. Because if you get your surgery and you don't write Michaeline, I don't take complaints. So let's move on. Children, we want to push it in the education system. We want to push it out there because we have a problem. I know we have a problem. We have a problem. And I'm telling you the problem, and Dr. Emma and Dr. Abel and the doctors here may not like it. Dental practices do not look child-friendly. They don't. It is time the dental organizations across the world make their dental practice look friendly. Even if you put some kind of donuts or some, well, you can't put donuts because it's sweet, but you have something for children to think that they're not going to be harmed. And it's a place that they can go and it's friendly. That's the very first thing. Dentists must start going to schools and you know, and do. How many people here can say they've been to the dentist and they saw something that is child friendly?
Can I just say something quickly? It's actually quite on the contrary, because one of my practices in Dansoman, which is a city in Accra, this is how, I don't know if you could see it from there.
Yes, I can.
This is how my dental, kids.
Go Ghana, because I am telling you now, that is innovative, that is amazing. Professor Rotimi, you see, Ghana doing stuff, Africa doing, have you seen that, Professor Rotimi? Tell me how many dentists you see like that. Look at that.
Let me just increase the screen.
Good. Let's give that practice a round of applause. That is amazing. That is amazing. Look at the colors.
Can I make a comment on that?
Yes.
I think one of the problem is what you have highlighted. I think especially in the UK, I think the emphasis on children dental health has not been very good. I mean, if you go to other places, until COVID came, we always have play area for kids in general practice, in accident and emergency, in GP out of our service, but not in dentist areas, places. And I think it's important. It's a very good point that you have made.
I'm sure there's one or two. I am sure there is one or two. Look, Brenda say hers has a fish tank, puzzles, and freebies as well. But that is not a national thing. But because before doing this webinar, I was sort of trying to look at dental practices as a pass along. Do they have a sign? Do they have something that, you know, when you say to your child, I'm taking you to the dentist, it feels like as a place that they're going and it's really children friendly. Professor Rotimi, what do you say about that? Because, you know, we've just collaborated with the Dental Association here, so they'll be watching this. I want them to know, hey, children nowadays want to see something looking like them, not only for their parents. You know, they don't want to see magazine and newspaper. They want to have some fun.
Yeah, just to support what Dr. Adegoke has said, I think most dental practices, they're private organizations, not NHS run, and I think they cater more for adults rather than children. And that's not to say children don't have dental problems, but I think they haven't thought about it. And this is why a webinar such as this is informative. And I think Dr. Oliveira's surgery, thank you for sharing what you are doing and what Ghana is doing as trailblazers. I think the advantage of webinars is to get ideas. One of the things we probably will be taking away tonight is to get to our dental folks in the UK or in the Western world to say, why don't you make your service child-friendly? Going to a dentist invokes a lot of apprehension, not just in adults, but what about children? So thank you for raising that, and I hope we'll take it on board.
Yeah. So coming back to child's education, and Dr. Emma, I congratulate all those who make the effort. Tell us some of the issues if you don't take your child to see a dentist, but you just leave them, and you know that will fall out, it will grow back, it will, and you only, you know, people tend to take them only when there's a crisis, when they need, you know, braces and all that kind of stuff. What would you like parents to hear about child care in regards to the dental well-being and taking care of the dental health?
Okay, so first and foremost, dentists, you are very friendly. You have soft hands. So we are very nice and friendly people. So coming to us doesn't need to be apprehensive at all. When it comes to children, I believe that the earlier you bring them to us, the better, because then we instill the culture of visiting the dentist periodically into them. And then I think I read a research that looked into education and kids not doing well at school and then oral health. And it's boiled down to the fact that once they have cavities, they are in pain. So therefore, they are not able to pay attention in class. And it correlates to the fact that they don't do well academically. And it's also, and they end up being absent at school. So school absenteeism and not doing well academically was some of the things that were raised in the research concerning kids. So it's something that from one thing leads to the other. See, missing school, not doing well, you might think it's just something out of, but it's linked to oral health, you see. So bringing them in, it's very important because we're able to pick up issues, we're able to solve them before they get worse. And once we instill that habit into them, they grow up with it and they feel confident seeing us often. So it's imperative for parents to have that culture, you see, that habit of ensuring that their kids visit the dentist periodically or when they have issues, and not think that the teeth will fall out just because they are young. The adult teeth usually start growing in a child's mouth from the age of 6. These days, we have 5-year-olds presenting with adult teeth. You see? Yes. So it starts from these days, the kids develop so fast. So you see 5-year-olds having a couple of adult teeth already. Before, it used to be 6. So up to the age of 12, some of the teeth falls off and others come in. And then as that is going on, the jaw keeps expanding to accommodate more teeth. That is how come when you see a child's face is different from an adult's face, because the jaw expands to accommodate more teeth. So the teeth that were previously at the back of a child's mouth, as the child is growing, start moving forward and then it will start falling off. So don't ever think that, oh, because my child is 6, my child is 7, my child is 10, it's baby teeth and they will lose all. No. At that age, they have what we call mixed dentition. So they have the adult as well as the child, the baby's teeth. Okay, up to the age of 12, that happens. And then after 12, most of the time, they had shed majority or all of the baby teeth, and then they will just expect the third molars or the wisdom teeth to grow. But like I said before, interestingly, you have 6-year-old and 5-year-olds having quite a number of adult teeth already. A friend of mine has a 9-year-old, and she has almost all her adult teeth in place. So things have really, really, really changed. And so don't ever think that, oh, I'll just take the child when the child is adult. No, I mean, when the child is fully grown, no.
Okay, we have quite a few questions, but before we do, let's tackle some key things here. Bad breath. Bad breath. Dr. Abel, bad breath. You know.
Yeah, it's a very embarrassing situation that people find very difficult even to come to us with, even though we're the one who can help them. And like we say and have said many times today, it's not only mouth problem that can present with mouth issues. So bad breath could actually be a presentation of something going on worse than in your mouth. For example, something we call gastroesophageal reflux disease, when acid comes back, can create bad breath. But it can actually also be a picture of something even more sinister and dangerous going on already in your body. So bad breath, as embarrassing as it is, my point would be, please, 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 please rock up at a dentist place or show to your GP. Obviously, dental caries, dental infection, abscesses can be the cause of it, but often it could be something more sinister. And so it needs to be looked at quickly.
Thank you. Dr. Oliveira, what do you think about that? What do you have to say? Because bad breath is a problem.
Yes. So bad breath doesn't really come from the mouth. It can come from the ear, nose, throat. And as you rightly said, from the stomach. Apparently problems in even the liver could also lead to bad breath. So it's something that it's something that you have to take seriously. Now, when you come to the dental clinic, for instance, and you have bad breath, it's usually because of cavities or calculus. So once that is done and the problem still persists, we refer you to the other specialties. So we let you see the ENT specialist, because problems with your sinuses can also give you bad breath. And then also we refer you to the gastroenterologist to solve that issue as well. And when all those areas have failed, we consider it to be neurological. So we refer you to the neurosurgeon to have that also assessed.
Thank you. You know, on the market, there's a lot of commercial products, different type of mouthwash with lime, mouthwash with cranberry, mouthwash with all sorts in it. And you go to buy toothpaste, and I mean, I don't want to give up my age, but when I went, there used to be just toothpaste for whitening and toothpaste. Now there's toothpaste for everything, you know, every single thing. Can you tell us about mouthwashes? Because some people think that they must buy a mouthwash because it's an important part of dental health care, and they must buy a mouthwash, and they must buy a toothpaste that says gum, this, that, you know, all the ticks in the box. I'm not calling any company name here, but some of them have all the ticks in the box, and you think, yeah, I need to buy this one. Then there's the natural toothpaste, which is a black one. When I went to America, I see my uncle have this black sophisticated toothpaste, tastes like charcoal. You know, so there's all types. Help us.
Okay. Yes.
Help the poor lady who is maybe a single mother or a mom and dad and have 5 kids and need to get some toothpaste in the house and feel that they must also have mouthwash and they must have the top of the line because the cheapest brand may not work.
Okay. So when it comes to mouthwashes, I don't recommend mouthwashes at all. We only recommend it for treatment purposes only, and that's it. Okay, so it's not needed in my opinion. Once you're brushing very well, using all the techniques involved, then it's something just fancy. You don't need to use the mouthwash because sometimes it causes more detrimental effects than being advantageous. Mouthwash, when we refer or we prescribe it for you, you're supposed to use it just for a duration of time. So for instance, when you have bleeding gums and we treat you in the clinic, we recommend or we prescribe a specific mouthwash for you to use. Most of the times we prescribe it for just 2 weeks or maximum a month, and that's it. You just put it somewhere and then continue brushing effectively. So I'm not a fan of mouthwashes at all. Okay, now when it comes to the paste, for me, it doesn't really matter the brand. What matters is the fluoride component in it. And also for the fluoride component, it has to be age appropriate. So you have paste for 0 to 2 year olds, you have paste for 3 to 4 year olds, and so on and so forth, because they have the right quantity or amount of fluoride in them. So it's recommended you use an age appropriate paste. So when you're an adult, and you have to use an adult paste, obviously, because it contains fluoride, and ensure that there is fluoride in it. So when you take the paste, you could turn it around and then read the ingredients that comes with it. It's always at the back. Okay. So that is it for me. But mouthwash is not recommended by me at all. I'm not a fan of it.
Well, you know what? Yinka was throwing her hands in the air. It was like a party. Yinka, why it is you don't use mouthwash? Why you were so excited by that?
No, it's not me. The kids have always liked to use mouthwash, and whenever it runs out, they're like, "Oh, mom, I'm like, buy your own." I mean, the twins are going to be 21 this year. They're like, "No, it's too expensive." Oh, but I should buy it. They say, "Yeah, it's part of the stuff that you buy with the grocery." No, so I stopped buying it, and I said they don't need it. So when you said that, I was very, very happy.
Okay, good stuff. Let's talk a little bit about dentures and I'm going to come to Abel about this. Dr. Adegoke, talk to me about dentures, because we know dentures is a problem in the health setting as well, in hospital settings. It's not properly fitted. People lose weight, put on weight. It's not properly fitted, as well as they're not washing them properly. Dentures is a real problem. You know, sometimes you talk to people and it moves on its own accord. You know, people, what do GPs have any role in regards to dentures at all?
No, not strictly speaking, but we make comment on them. It has its place and it has its usefulness. It enables people who ordinarily would have been edentulous to be able to at least maintain the shape of their mouth and their face. Also use it in grinding, in eating certain stuff. However, like you have alluded to, it has to fit properly for it to function efficiently. Secondly, it has to be taken care of. There is a specific care for denture. And each time it's issued out, people are given those instructions. Unfortunately, many people don't follow those instructions. That's why they get into trouble with their denture.
Okay.
It has its place. It has to be followed. It has to fit properly. And the instruction to maintaining them, keeping them hygiene, should be followed very well.
Tell me something. Is it a commissioning aspect? So someone needs dentists. Is it free or they have to pay for it?
It's not free. We don't prescribe it, and the dentist charge for it.
See, people, see why this webinar is important? Because when you get to a certain age and you lost your goodies here, you have to pay for it. Yeah. So remember that. Thank you for that. I will take extra care and avoid the carrot cake now that I know I have to pay for it. Emma, can you tell me about dentures? It is a problem. people, there's so much on the market, Dentia Fix-It, Dentia, all sorts. And elderly people are really trapped into this. This is an economic thing. It's costly. You know, tablets, I can't call who in my household have it because they might kill me, but tablets, all sorts, you know, it is expensive business.
Which we shouldn't be. Taking care of dentures shouldn't be expensive at all. I'm very simple when it comes to certain things. You know, when it comes to dentures, for me, is you could use a sponge or just a brush and soap. You don't even need to use any paste to clean your dentures. You just need water and soap, which is, the soap shouldn't be scented. So any good non-scented soap, and then your brush, you can use it to clean it well. And you could just put it in water when it's not in your mouth. You don't need any fancy solution to keep your dentures. When it's not in your mouth, after cleaning it with soap and brush, you just rinse it under water and then keep it in water. Okay. Now we have two main types of dentures that we currently use here. We have the acrylic dentures and then we have the Valplast dentures. The difference between the two is that the acrylic dentures are quite hard because they are made up of the acrylic material. And the Valplast dentures are very soft and flexible, and they are even smaller, very small. So it's convenient for people to use them. You can't just buy dentures from the market. You need to come to the dentist. They are custom made. There's a process in fabricating them. So when you come in, we will take some measurements of your mouth and ensure that we do dentures to fit your mouth, okay? So that they become functional. They are not for cosmetic reasons. They are for functional. They are supposed to help you to be able to chew your food properly. Because when you're able to chew your food properly, the body is able to digest it properly. So it's functional. You need to come in, and the denture is fabricated specifically for you. And like I said, taking care of it shouldn't be a hassle. It should be very easy. You just use soap and a sponge or a brush, clean it nicely under running water when it's not in your mouth, and then keep it in water. You could change the water frequently. You shouldn't keep the same water over and over again. You could just change it frequently. So the way you take care of your oral cavity or your teeth is the same way you take care of your denture. Make sure that it's always clean and it's kept well.
Does that apply to dental implants and bridges?
So dental implants and bridges. When it comes to dental bridges, for example, there are different materials that we use in fabricating bridges. We could have what we call the porcelain fused to metal material. We could also have the zirconia crowns of bridges. The zirconia ones are quite costly because they are aesthetically higher than the porcelain fused to metal ones. The porcelain fused metal ones simply means that there is porcelain at the outside of it, and then you have the metal inside, okay? And sometimes they're not, what happens is that the color shade sometimes doesn't match your teeth so well as compared to the zirconia or the EMAX ones. In Ghana, for instance, the porcelain fused to metal crowns or bridges ranges for about 4,500 Ghana cedis. And then the zirconia ones are from 6,900 Ghana cedis, which is very costly. Also, before we recommend you to have bridges, for example, we need to look at the existing condition of your oral health. If you don't take good care of your oral health, there's no way I personally will recommend bridges for you because they will fail. Okay, so the long-term use is also very important. We look at when we fabricate and when I'm taking care of my patients, I look at the long-term prognosis. So it's not just for a short while. You need to look at the long term, how the person is going to maintain or keep it for a very long duration of time. So when you don't have a good oral hygiene or you don't take good care of your oral health, there's no way I recommend bridges for you because the possibility of them failing is very high. And also, so with the bridges, the concept is just like a regular bridge. You use a healthy tooth on one side and another healthy tooth on the other side to replace the missing one. Okay, so for instance, if you are missing a tooth in the middle, the one which is healthy on the right and the one which is healthy on the left are then sort of like sacrificed to replace the one missing. So we sort of like trim them down a little bit so that we could use them to replace the missing one. And so it's a little, I would recommend more of implants than bridges, because I see bridges sometimes as a little distracted, because sound, healthy teeth are sacrificed to replace what is missing. Whereas when it comes to implants, you don't need to use the sound, healthy teeth on the side. You just go, place your implants, make sure it's well adapted, and then you're good to go. So the healthy teeth are preserved, and implants can last for a very long time. The only downside of implants is the cost. They are very costly. But when it comes to their efficacy, or they are very efficient. Once they are placed there, they act just as your normal or natural tooth, because they form a bond with your bone, which we call osseointegration. So there's a bond. Once you place the implant, there's a bond like that. It's well adapted and it behaves just like your natural tooth. But it's not everyone who can have implants. Certain illnesses or diseases that you may have might not require you to have the implants. So it's very case selective.
Okay, so thank you very much for that. I just want to go to one thing. You know, Dr. Emma, thank you so much from being in Ghana. You know, it's really important to me that that globally the world recognizes that we have specialists from all parts of the world and specialists in our diaspora. We have specialists in India, we've got specialists in China, we have specialists in Africa, we got specialists in the Caribbean, and that we have specialists. And it's that power in that knowledge that must be recognized. And that's why I champion people like yourself who are doing amazing work, and that this could be shared across the globe. Do you do dental tourism? Because let me tell you something. There are some countries, and I'm not going to call them, are known to be the gurus. Oh, I need to get some white porcelain over here. You fly, you get it done, you come back. So just tell us, you know, do you entertain people like myself and Trisha and Sandra going to get on a plane? We got to come over to Ghana and to see you, and you know, you got to put some dental implants. Well, I know who need dental implants and who got to walk away with whatever. But you know what I mean? Do you?
Yes, I do.
On a serious note, do you embrace people from around the globe who might want to come and get, you know, and look sharp? Isn't it, Professor Rotimi? We want to look sharp for November, Leaders in Health and Tech, isn't it? We want to, you know, Leaders Health and Tech is MHM Health Consultancy annual seminar that deals with health across the region. So we want to come in advance. So
Great.
Tell us the process to come over to Ghana and to see you in your practice, so that, you know, we can have the best care.
Great. Before I tell you that, I just want you to see something. I'm just going to put it closer once again. So can you see it?
It's reflecting.
Wait, it's Blair. Okay, wait. Is it better?
Yeah. Wow. Ooh, very sophisticated.
So this is one of my dental practices, okay? And this is the certain area. Before I talk, I just wanted to see,
wow,
so I could explain further.
Actually, if I share the screen here, I may be able to show them one of your let's see, that's you there in the practice, isn't it?
Yes, inside my practice.
Yes, it's a very sophisticated practice. Yes. So tell us about, we can't see your face anymore. So tell us about your practice. Tell us a little bit about your practice.
Okay, so the reason why I even showed you the picture was because I want you to understand that we want to make sure that dentistry is, you feel comfortable when it comes to us, okay? Because there's a lot of fear when it comes to dentistry. So before you get attended to, you get to sit in a very nice area whereby you feel very comfortable and at home. So by the time you get seen, you're already phobia free, you see. And we are very specialized clinic. We offer all specialties in dentistry. It will interest you to know that dentistry has a lot of specialties as well. Most people think once we are dentists, that is it. No, we have different areas of dentistry, different specialties under dentistry. Okay, so we have the periodontologists, we have the orthodontics, who is the dentist specialized in correcting teeth with braces. We also have the cosmetic dentists, we have the implantologists, and so on and so forth. So there are several specialties under dentistry, okay? And we offer all the specialties. So once you come, it's like a one-stop clinic for you to be seen and it's renowned. I mean, our clinics are very spacious and we have very sophisticated gadgets. We have this intraoral camera, so you get to see whatever is in your mouth on the screen. And I believe that it's important for people to understand whatever they're going through, because once they understand, they give priority to it. So you come in, we let you see, we explain everything to you. And once you're comfortable, we drop a treatment plan and then start your treatment accordingly. And we work hand in hand because we have to do our part and you have to do your part as well to ensure that whatever has been done is maintained well. So I believe in that collaborative effort. So, yeah,
can you please put your details in the chat room so that people can contact you and in regards to that? Dr. Abel, you know, you're cardiovascular, yeah? And people might think, oh, you know, I want to talk to a GP who specializes in that, and how do I reach out to him? Can you tell us how they could get in contact with you, and also put your details in the chat room as well, please?
Yeah, I work for NHS, so if you want to see me, it's probably going to be a free service as long as you have access to NHS service. However, if you need private consultation, I'm also available. It's important for us, my own specific aspect is prevention of cardiovascular problem. As I've mentioned, is the commonest cause of death, but it's a highly preventable cause of death. And so if people know about or they're interested in knowing how they can maintain their cardiovascular health, yeah, please feel free to contact me. My email address is going to be put up now.
Thank you. And and Emma is based in Accra. So before we close up, there is something that is really important to my heart. We've had this discussion. We got to go around the room and ask questions. But before we do, there's something that I need everyone here, including the attendees. How can we encourage our communities to start accessing dental health dentists more than we normally do, instead of it being every 3 years? How can we start getting kids to and maybe interested in it as a career as well? What do we need to do? And I would start off with Professor Rotimi and work my way around. Professor Rotimi, what can we do? We have a problem. What do we need to do?
Yeah, I think it's talking more about it. The benefits of good oral health is important, and that message needs to get out there. I think that's one of the things we haven't done globally, is to talk about it. But I think we're coming to the realization that oral health is important. And I think that's one of the reasons we are putting this up. We've not done this for within the last 2 years. But I think the message has to be got out there to policymakers, people who develop services. And again, as Dr. Adegoke said, and as we know, most dental practices are private. Why should they be private? Now, when in the United Kingdom, we're talking of integrated care services. Do we have dental services incorporated in that? The answer I don't think is yes. It isn't. And why shouldn't it be? We're talking of cardiovascular problems, we're talking of halitosis, and so many things. So why can't we incorporate dental health into public service? And I think this is something BHC can take on board, more so while ICSs and ICBs are being brought together. For Africa, for Ghana, for Nigeria, Rwanda, I think, again, countries are the same, human beings are the same. Again, it's to get that message out there. The Coca-Cola industry, the soft drink industry damages our health. Emma might help me out with this. Apple, I think, is not the best thing for the teeth. Am I right?
Yeah.
Yeah. So some of these things people don't know, but you tuck your teeth into apple, into some of these fruits, and they're not good. So I think it's more education, education, education.
Thank you. That is really good. Dr. Abel, what do you say in regards to education? What do we need to do? Routine say education. What is the next step?
Yeah, I mean, for us, and that's why I'm in BHC. We need to get the message out there. We need to get the message out there to everyone we know, starting from our own family level to the people in our community, the people we relate to, either in the church, mosque, community center, wherever, and let them know that you don't necessarily have to be petrified when dental or dentist name is mentioned. Emma has reassured us. They are very friendly. They are very good people. I have friends who are dentists. I have had dental work done on me myself, and I think I'm happy. And so we just need to disabuse the fear, because once you mention dentist, people think of pain.
Yes.
It's like they are bad people. They're going to inflict you with pain. No, they're there to help you. The other thing we need to do is, I think as parents, we've had it, and it's important that we put emphasis on the dental care of our children. Don't just give them the toothbrush and ask them to do it. Show them how to do it, supervise it. When I was growing up, one of the advantages we had, I grew up in a village, is that every day we have dental inspection in the assemblies. I don't think that will happen now, but I think we should emphasize something that remind kids that their dental health is important, so that they are the one, because they will eat sweets. They will take all these sweet things that will affect their teeth. But we need to teach them also that once you take sweet, this is the antidote to prevent problem. And I think if we do that and we are persistent in it, and I want to recommend that BHC should champion that, so that we can actually make a major difference in people's dental health.
Thank you. I agree. Does anyone else have anything else they'd like to say in regards to how we can push the message out there in regards to I come to Emma? Anybody else? No? Okay, Emma.
Hello.
Hello. Econem? Is that Econem?
Yes, it is.
Oh my gosh, how are you?
I'm very well. I'm actually calling all the way from Nigeria, so
We
just happened
welcome
to
you.
know.
We welcome
Thank you very much. I must apologize that I haven't had access to the whole program, but just your last question was quite a good one for me. And I was taking the question from the other perspective of actually encouraging our young women and men to go into dentistry.
Yes.
Because that's where I was looking at it from, so that we're having more of our own representation within that industry. So I don't know, Dr. Abel and Dr. Emma, what the figures are for Black representation within it, but I guess it will be quite low, by
Yeah.
comparison to say the proportion of our use of it or need for it, because everybody has a mouth, everybody has teeth, but we need to have, you know, our own Black dentists who are actually out there like yourselves doing the work. And it's getting that message out within the school system that there is openings for, you know, going into sciences or whatever is required, because I think a lot of times people don't know what's required, and so therefore they hedge away from it, or like in my days they don't even get guided towards that
True.
sort of work or sphere of knowledge, you know, because even if they become dentists, there are other spheres within that area of building dentures, you know,
There's lots of work
helping
that they do in that.
exactly.
That's a very good
Exactly. Thank
point.
you.
And that's one of the things I said about earlier about actually encouraging students to come in that. Before I come to you, Emma, I just want to say, it's not only the Black community, there's not enough Chinese dentists that you see out there, not enough Turkish dentists. There's a whole groups of communities that need to see their own representatives in regards to not only that, pharmacists. You know, if you're looking for a Black pharmacist in the UK, there's one or two, but they're not everywhere. And we are coming in a time where we want to be actually treated by people who look like us. That is becoming a more and more for demand. I was in a survey and I saw the results of that. So that's a very good point. Dr. Emma, you want to pick up what Ekenem said about that?
Yes, I just wanted to say that the knowledge and awareness are critical, yes, but they cannot create just a brushing habit, okay? The changing in behavior needed to brush every day, day and night, can only happen when it becomes a social norm. So that is where we need strong partnerships. So you have businesses and NGOs working hand in hand alongside teachers, the government, midwives, community health officers, and we all need to come together to bring about an enduring change in habits and develop sustainable strategies. That could include the most vulnerable people in our society, such as children, and then the elderly and those in the rural and undeveloped areas. So we need that collaborative effort.
Okay, so thank you. We're going to come to a close, but before we do, we're going to go around and ask some questions. One question from Sandra is a very good question. Is that how often should you be brushing the tongue?
Okay, so to brush the tongue, it's you have to, when you're brushing your teeth and gums, you need to brush the tongue as well. So if you're going to brush your teeth and twice a day, you need to brush the tongue twice a day as well. The tongue, like I said, is a muscle. It harbors a lot of microorganisms, and as you are talking, as you're eating, the tongue keeps moving around. So whatever is harbored on the tongue gets spread to other areas of the mouth as well. So it's imperative to brush it alongside brushing your teeth and gums.
Okay. What about electric?
That, please.
1 second, Ekenem. What about electric toothpaste versus toothbrushes versus manual?
For me personally, I prefer the manual, because with the manual, you have control. You can control it and take it wherever you want to. When it comes to some of these electronic gadgets, it's very difficult for you to maneuver them properly. So I'm still old school, I'm still old fashioned. I prefer the manual brushing because I have control. I like to be in control of what I'm doing. So I prefer the manual one because then I could move it, you know, all around. And the brush has to be in an angulated form when you're brushing, okay? You need to ensure that when you're brushing the outer surfaces of the teeth, because the teeth has 5 surfaces, the outer surfaces, and then we have the inner, the side, and then on top of it. So when you're brushing the outer surfaces, for instance, you put the brush in an angulated form, like a 45-degree angle, and then you go in gentle but circular, you know, it has to be gentle, firm, and circular motions all around. When you're brushing the inner surfaces, the inner refers to the areas that faces your tongue and then your palate. You brush them like in one direction only because the gum there is different from the one outside, okay? So you brush, you know, in one direction only. And then in between the teeth, you floss because the brush is not able to clean in between the teeth properly. That is why there's a need to use the floss. The floss enables you to clean the areas in between the teeth. And on the surface of, or the surfaces of the teeth, you use firm grip. So you go forward and backwards. The surfaces are very rough. They trap a lot of food. So when you don't brush them well, the food gets trapped there and you're unable to take them out. So that is where you do the forward and backwards motion so that whatever is in and has been trapped can be effectively removed. So once you're doing that, you brush the tongue also, okay? And then you complete, because so it's not about the number of minutes that you use, it's about how effective and efficient you clean all these surfaces.
What about the upper cavity, brushing the upper cavity?
So the mouth has the upper jaw and then the lower jaw, okay? Now, whatever you do for the lower jaw, you do the same for the upper jaw. So the upper jaw also has the teeth there, has 5 surfaces, just like the bottom one. Now, when you're brushing them, like I said, you put it in an, I wish I had a mannequin to make it easier, but I'll just use myself to demonstrate. So you put the brush in an angulated form like that, okay? Like a 45, assuming this is the brush and this is the tooth. You put the brush in an angle, you don't do this, okay? You put it in an angulated form, like a 45-degree angle, and then circular. So assuming this is the gum and that's the tooth right there. You put it right at the junction between the gum and then the tooth or the teeth. And then you go in circular motions all around. So you start from one side and you go all the way across to the other side. Once you're done, you do the same for the inner surfaces. Okay, so the surfaces facing your palate, that is for the upper jaw. You brush in one direction. So you scrape it out like that in one direction. And then on the surfaces, you do that. So you do the forward and backwards motions. It shouldn't be too vigorous. It should be firm, but not too vigorous. So you do the forward and backwards motions like that. And then you use the floss to clean in between.
How long is this process?
And like I said, it's not about them. It doesn't matter the number of minutes you use. It's about how effective you do it. So it should be very effective.
I'm glad. I'm gonna play this to my husband because he'll be there for a long time. And I finish and I think, am I getting this? Thank you so much. And I saw Yinka. Yinka was smiling when he said manual toothbrushes are better than electric. So we'll go around the room and ask questions and bring this to a conclusion. Yinka, you are first. What questions do you have?
Sorry. Yeah. Something I thought about earlier on. I've had the same dentist for about, oh goodness, 30 years now. And I stayed with him because he seems to understand my teeth. I mean, when I first used to go to the dentist, I'm one of those, as old as I was, they used to give me something to numb the gum before they gave me the injection to numb the gum, because I wouldn't open my mouth otherwise. I was petrified. So because of that, I took the kids quite early because I didn't want them to have my fears, and they now all go on their own. It's fine. But one of the things he said to me is, our teeth are different in that our gums go deeper than the Caucasian, our roots go deeper into the gums than the Caucasian teeth, and sometimes they are curved, which is, he said, a lot of our people have problems when they have extractions because sometimes it's not done properly. Is that true?
It's true. So it's true actually. So it's about the structure of our jaws.
Okay.
Our bones are quite dense. Okay. Right. So because of the density of our bones, it becomes a little bit difficult when extracting. I remember when I was in Brazil, I was the only Black in my class. And every time we had a Black person come to the clinic to have their teeth extracted, I was always the one called to carry out the extraction. So every time a Black person comes, then I know, Emma, you're going to be called to do the extraction because it's going to be a difficult extraction. So what you're saying is very true. We have very dense bones as compared to the Caucasians.
Extractions that they would have taken me to hospital for, he's done in the surgery. He said, if you can handle it, we can do it here. Because I wouldn't, he said, it's better for me to do it here than you go to hospital where they're going to cut your gums and all of that. So
because sometimes we do them under general anesthesia for people who are petrified, who have a serious phobia when it comes to seeing us. So we do use general anesthesia and very extreme cases. But with general anesthesia, and you need an anesthesiologist present, so the cost becomes quite expensive.
Right.
Thank you.
And the process is longer.
Okay, thanks. Sandra, do you have any questions?
Sorry. No, I will say it's been a fantastic session. I've learned so much. No, but thank you.
Thank you. And Janine's iPhone. Janine.
Hello.
Hi, Janine. Thank you for coming on so early. We really appreciate you being here.
Thank you. Thank you so much.
Do you have any questions?
No, I don't. I think the panel did a good job. Thanks.
Thank you so much. Trisha, do you have any questions?
No questions from me. Thank you.
Thank you. Brenda, do you have any questions?
No questions for me. I think Emma answered a couple of my questions while she was doing her talk. So that was great.
Okay, there's someone with the telephone 1357 54206.
Yeah, that's me. I don't know why my name's not coming up. That's me.
Okay, that's fine. Akanem, do you have a question?
The question thank you once again. It's been a brilliant session and I've learned something new about the way in which our teeth curve. And that just emphasizes what you were saying earlier on, Michaeline, about the need for a variety of, cultures to be involved in dentistry because we understand ourselves best. The other point I was wanting to ask about was the use of tongue scrapers. I remember when I was growing up, even in the UK, my father, despite using a toothbrush, would always use a chewing stick. And strangely enough, they've come back in a funny sort of way now, and much more expensive than they used to be. But they would use a chewing stick and then use the edge of the chewing stick on a flat surface to scrape his tongue. Now they've made implements in plastic and in copper for the use of cleaning the tongue. And I think that is also much more effective than just using your brush. Could I have a comment from the doctors on that?
I'm glad you asked that because as a child growing up, my once a section of my family, they used hibiscus stalk to chew on and clean the tooth. So I glad you asked that. It's very refreshing. Go ahead, Emma.
Okay, so when it comes to tongue scrapers, it's good for me. I can't say use one or the other. Both are very good when it comes to cleaning the tongue. I personally use brush. So with the brush, I have a very firm grip, and then I use it to clean. But you could also use the tongue scrapers. And some of the brushes, as you rightly said, have got these things at the back of them. That helps to effectively clean the tongue as well. So anyone which you feel will be okay for you to use, it's fine. It's just about you being comfortable using them.
Thank you. Professor Rotimi, as we come into the close of this has been really great. African toothbrush got a place in dental health. Whoa, that is so important.
Yeah, thank you to the panelists.
Yes.
I think I have one question, a comment for each of you. I think the first one will go to Dr. Adegoke. We've heard about it, the African chewing stick. How effective is it? Emma might also want to contribute onto that because we used it as youngsters, and I'm sure people still use it. Is it good? Is it effective? That's number one, and either of you can take it. I remember as a youngster that going to parties and opening the beer bottle with her teeth was a sign of being macho. What will Dr. Oliveira say about that? How do we get that message across to the youngsters that you don't impress women by using your teeth to open the bottle? Thank you.
Okay, so can I take the chewing stick first?
Yeah.
Okay, so when it comes to using the chewing stick, some people use it too aggressively, and by so doing, it causes what we call abrasions on the teeth surface. Okay, so it becomes detrimental to the health of the teeth. Okay, so using it shouldn't be in an aggressive manner. It should be in a very subtle way. And so I don't really encourage my patients to do, because I'm not there to supervise the way they're going to use it. What we tend to see in the clinics is people come with abrasions and they lose their teeth, because when the abrasions are very deep, number one, it becomes very costly to treat. Sometimes almost impossible, to the extent that the whole tooth has to be extracted. So I see a lot of the tooth, the chewing stick causing more harm than good. Okay. And then your second question, please. Oh, bottles. It's a big no. It should never ever be done. It's like a big taboo. No, please don't ever use your teeth to do any other thing apart from chewing your food properly, so that the food gets digested into the body for proper absorption to take place. Right. Apart from that, nothing else. That's for smiling. So your teeth helps you to smile, helps you to talk, helps you to eat very well, and that's it. And it's not for opening bottles whatsoever, because
in fact,
it's more fractious than any other thing. So
in fact, it's my wife who demonstrated it clearly that it shouldn't be used. The first time I knew about dental emergency in the UK was when she tried to open a bottle and it went horribly wrong. So, and I learned from it from then. Chewing stick, I mean, the ones that some people used contain some specific thing, just like we're saying, some specific ingredient in them, which may be useful. But I think, like Emma, my reservation is in how you use it, and the tendency to damage not only your teeth, your gum, the entire mouth, even your tongue. So thankfully, toothbrush is available everywhere in the world now. I know people's teeth are very, see, when you're used to certain things, it's very difficult to change some people, and they still use it. But as long as they realize that it can do more harm than the good it intends to do.
Okay. Well, listen, this has been really a great beginning for BHC. Our health webinars are back on, and we are so happy to have an international award-winning dentist who specialty. Tell us all your specialty, Emma.
Yes, there are lots.
I know,
Okay.
from cosmetic, dental, implant, everything that you want. I think it's so great that we have your details. Could you put the name of your dental practice so that people can look it up on the website and contact you, be it on behalf of BHC, BAME Health Collaborative? We want to thank you for taking the time out to join us today. We've learned a few things, and I know that Dr. Adegoke will actually, and Professor Jaisimi, and also Yinka, and everyone else will remind us. So the very first thing is that toothpaste, you don't need to buy the most expensive one. Good fluoride content. Yeah, you don't need to go and buy mouthwashes. You know, do Yinka style. Let's just, you don't have to. If you want to, that's up to you, but it's not critical. You don't have to buy an electric toothbrush. You know, your manual toothbrush will do a great job. It doesn't have to be hard. If you want to use your African chewing stick or Indian chewing stick or Caribbean chewing stick, remember it could damage the outside of your good healthy teeth and you could have a problem. What else have we picked up? Charcoal. What did we say about charcoal toothpaste? I can't remember what we said. Dr. Emma, what did we say about charcoal?
We haven't said anything, but I don't think it has a place. I don't know any toothpaste toothpaste we're using must have adequate fluoride like we have had.
That's what we said. We did talk about it. I did say about my uncle using the charcoal, and we did say fluoride. We did talk about the cardiovascular. So round up now cardiovascular, Dr. Abel, what you want to say about that? Round that up for us.
It's a very important aspect of our lives. Your heart make you tick, make you move, make you what you are. And if it's a pump, basically, that God has given you, if it fails, you will fail. So the important thing is make sure that that pump carries on doing what it's made to do for as long as possible with minimal problem.
Thank you so much. And Professor Rotimi, as the Vice Chair of BHC, what do you have to say before we close off this wonderful, informative, and it's just been brilliant.
All I have to say really is to thank Dr. Adegoke for a very insightful presentation. Dr. Oliveira from Ghana, thank you for sharing your knowledge with us, very inspirational. To all the participants, thank you for taking time out of the evening to be with us. And to our hostess, Michaeline, thank you for a well-conducted webinar. I have learned a lot. I wish I knew some of these when I was a toddler or a younger person, but it's never too late. Thank you.
Thank you. So on behalf of BHC, we say thank you. We just see someone called Stephanie M, who is just joining us. Unfortunately, Stephanie, you joined at a point when we are just about to close off, but do you have a question for our panelists? We're giving you the opportunity to ask a question quickly before we leave. Stephanie, can you hear us?
Just connecting. Yes, just connected.
Right, Stephanie, we are just about to close off. You will be able to see the video, but we are giving you an opportunity to ask a question about dental health care before we leave. You are very fortunate. So ask us anything about dental health care, and you will have the specialists on board will be able to answer.
Oh, thank you so much. Hello, everyone. Such a nice program that you've put up together. We sort of tend to forget so much about our teeth and, you know, what feeds our stomach, unfortunately. Yeah, so I wanted to ask, I've had a wisdom tooth and it came off naturally. Is it possible to have a fake wisdom tooth? Or like a denture?
Okay, so the wisdom teeth are usually very far back and we hardly chew with them. The teeth that we use in chewing are the first molar teeth and then the second molar teeth. The wisdom teeth, we don't chew with them at all. They are just there. So we don't really replace them unless they serve as what we call support or abutment for a missing first molar tooth, for example. That is the only time we replace them. But once you've lost them and you have all other teeth present, then it's not necessary to have them replaced.
All right.
Thank you for that. I think Ekanem wanted to ask a question before you, Professor Rotimi. Ekanem? I think she did. You're on mute.
I've asked my question within the context of what we've done. Thank you.
Okay.
Sorry, Michaeline, can I just say something quickly? It might, even if it only helps one person. I've been a cardiomyopathy patient now for about 20 years. And whenever the dentist would see me for any procedure, he'd always give me prophylactic antibiotics for about 2 or 3 days beforehand to help with infection. The one time we didn't do that, I fell very ill. So what Dr. Adegoke was saying about infection and the heart, I had that experience and it was quite bad. I'm grateful to be here. So anybody who has heart conditions, make sure if your dentist is doing anything, you always have prophylactic antibiotic cover beforehand.
Sorry, can I just add to that don't even make sure alone, shout that you have it.
Yeah.
So that it's not forgotten, so that it's not overlooked. If you
Wow.
have any heart problem and you need a dental, the smallest of dental procedure, the first thing you tell them is, I have a heart condition.
Wow.
I just wanted to chip in something. Your medical history is very important.
Yeah.
When you visit a dental practice. Okay, you need to state out everything that you have because it helps us to also know what to do. So medical history is relevant.
Yeah.
Thank you. Professor Rotimi.
Yes, it's just an observation, and I'm not too sure who can help me out. Why haven't we got men as participants? Well, not as panelists, but in the house, all the participants are ladies, are female.
Because we are so proactive with our care, with our health care. Come
Right,
on.
so how can we address that?
I think our session that we're gonna be doing from April, remember from April this year, we kick off Men's Health Year 2022. And the reason for that is that during the COVID period, there was a lot of focus on pregnant women, children, everything, but anything to do with men's health was put on the back burner. So we really, 2022, we want to talk about the prostate. We want to talk about cardiovascular, because you see young men, how many young men now are dying from sudden heart disease. We want to talk about renal health care. And I know Tricia is going to be kicking off the marathon. So we want some of the men to participate in that marathon. And you and I, Rotimi, said we will drive in our car and make sure everybody is doing their walk and their marathon. And we will be monitoring them from the comfort of our car. You know, go by Dr. Abel, make sure he's doing his walk. You know, so Tricia, that's how we will be supporting. Rotimi and I have a plan. We have a plan to support the marathon. And I hopefully, Dr. Emma, you can do the marathon, the renal marathon over in Ghana on the same day, kick it off to support us over there. I know it's going to be done in Tobago, and I know that Dr. Adegun is going to do it in Nigeria. So we're going to have a global marathon. Tricia is the lead. Tricia, you have anything to say?
Ladies and gentlemen, it is a walk. Those who want to turn it into a marathon, you got my thumbs up, but I will be walking miles and miles, no problem, but I will not be doing a marathon. But I will encourage anyone who is so inclined, please do. Yes, yay.
You see why you've got to join BHC. On the note of that, we had some people from abroad who would like to join BHC and make BHC international. And that's something we'll be discussing, an international chapter for BHC. On behalf of BAME Health Collaborative, the ambassadors, the special leads, the members, and across the board, we cannot say thank you. We want to say thank you, Dr. Abel, for being part of BHC. We really appreciate your involvement. And Dr. Emma, we say power to your practice. And we hope that we will be able to invite you over here so that you could we believe in exchanging, so you can come over here and meet one of those dentists that Dr. Abel is going to link you in with. And so we can have some real powerful open sessions in regards where people can actually come like an open day. And we look forward to that. And Yinka is going to pay for us, all the others, for us to come over for some medical tourism, because she has the money to do that. So we'll be coming over soon. Good night, everyone. And thank you for being here. Good night.
Good night. Good night.
Good night.
Good night.
Good night.